So we can start.
Yeah. So, good evening, my dear friend. I extend a very hearty welcome to every one of you for this special session. It is very, very special because you are going to understand what is heart, what is kidney. It's on the vital organs. The knowledge of this will be very helpful to arrive at prognosis, diagnosis, and treatment. Leave alone, what you call examination. Examination, definitely you can face it easily when you attend this class. Other than that, these classes will be very useful because you will know the summary of treatise 11, 12, 13, which are very common from the perspective of treatment. That too from Professor Krishnamurti Lakshmana. We are privileged to have him amidst us for tutoring us. So, on behalf of every one of you, I extend a hearty welcome to our beloved faculty, Shri Lakshman Krishnamurti, to take charge. Welcome, Krishnamurti sir. Thank you.
Namaste, namaste, sir. Thank you very much. Okay. Hello, everyone.
नमस्कार सर.
Namaste. Namaste. Just give me a moment. Okay.
Good evening, sir.
Good evening. Okay. Fine. Okay. So, how should I take the class? As per the book or the way that I want to teach? So I have next 4 days, 1.5 hours to 1 hour 45 minutes each day. I have to cover 3 books, and each book I can it can be taught easily for 6 months. It is so vast. Okay, how would you want it to be taught?
नमस्ते सर.
Namaste. So I'll teach you something which is slightly off the book, but very important for you to understand the concepts. Is that okay? Huh?
Yes, sir.
I'm not. I'm
Yes,
hearing
sir.
only
Yes.
few. Yes.
Absolutely.
Yes, sir.
Okay.
Huh?
Yeah, fine. Okay.
Okay.
सर रिक्वेस्ट कर रही हूँ थोड़ा हिंदी में भी बताइए प्लीज. थ्रू
कौन
आउट इंग्लिश नहीं समझ पाती हूँ सर.
ओके. बहुत सारे लोग यहाँ पे हिंदी नहीं समझते हैं, तो बीच बीच में आपको थोड़ा इंग्लिश सीख लेंगे तो बेहतर रहेगा, क्योंकि छूट जाता है दिमाग से कि हिंदी में भी बोलना है करके, वो नहीं जमेगा. ठीक है, तो आप जितना पकड़ सके आप पकड़िए, और बाद में रिकॉर्डिंग तो अवेलेबल होगी, तो किसी की हेल्प लेके आप उसको बाद में समझ लीजिए हिंदी में. ठीक है.
सर इसका रिकॉर्डिंग जो है किस पे ईशान यूट्यूब पे रहेगा?
हाँ जी.
ओके.
ओके, तो विल स्विच बैक टू इंग्लिश. ओके, सो I'll try to teach some fundamentals or new learnings that I have had, and based on that, I will take the class forward and try to make you provide you something far more important than what is required only for your examination. Okay. Power of right diagnosis. Okay, I want to start with that. If we diagnose the root cause properly, how will be the result? I want to share a few things with you. Okay, just give me a moment. There was a patient whose left eye was not closing. The eyelid was not closing for probably 20 plus years. Okay. Only when he tries to close the eyes, only right eyelid is closing, left eyelid is not closing. So, and I treated him, and this is what I was getting. Okay, I'll try to show. So this is
बंद कीजिए।
can you hear the
अच्छा,
can you hear the audio and means audio also? Is it clear?
Yes, sir.
Audio and video both are clear, no?
बंद कीजिए।
So this is
अच्छा, लेफ्ट आई नॉट क्लोजिंग।
हाँ,
अच्छा,
left eye not-
नॉट क्लोजिंग। हाँ, ओपन कीजिए, फिर से बंद कीजिए। अच्छा, ठीक है। तो लेफ्ट हियरिंग।
Okay. For this patient, the left eyelid is not closing. Now I treated the patient, and after 10 minutes, this is how things are. Okay.
It is about 40% improved. Yes. In about 10 minutes.
10
ठीक है?
minutes.
ठीक है।
Okay. So 40% improvement in 10 minutes after applying the points. Okay. And this is after 2 days.
ट्राई कीजिए, ओपन कीजिए। तो कितना, क्या 80% तक तो हुआ होगा?
80% है सर, 85।
हाँ, और ये खींचने का कैसा है?
खींचने का 50% तक है सर।
50% तक इम्प्रूव हुआ
हाँ,
है।
हाँ।
अच्छा अच्छा, कितना दिन में हुआ है?
एक ही टाइम में लगाया सर।
एक ही टाइम में
हाँ,
लगाया,
एक ही
तो
टाइम में
उसमें इतना फर्क आया है।
फर्क आया।
अच्छा अच्छा, वेरी गुड। अच्छा जी,
ओके।
थैंक
Interesting.
Yes.
Huh? So if you properly identify the root cause of the problem, the results will be very, very quick. Very quick. And today I wanted to talk about heart. So I'll share one thing related to heart. Okay. Just give me a minute. There is one patient who has left ventricle, no, aortic valve. Okay, it is having stenosis. Okay, so you can see it over here. So I'm not showing the name, etc., to keep the identity of the patient. So it is on like 28th. Okay, so very severe aortic stenosis means the valve is not closing properly. Okay, so this is the in the echo report, and after about 7-8 days, after 7-8 days, this is the okay. So here they say no AS. What is no AS? No, there is aortic stenosis. There is no aortic stenosis. Means the stenosis part is fixed. In how many days? It is less than 10 days, like anywhere between 7 to 8 days. Do you think this is fantastic? Huh? From very severe,
Yes, sir.
from very severe aortic stenosis to no aortic stenosis in how many days? Less than 10 days. And which organ did I treat? Any guess? Those who want to speak, you will have to unmute yourself. Which organ did I treat? Hmm?
Brain.
Sir, spleen?
Brain. Brain.
Heart.
Brain.
Liver?
Spleen?
No.
Liver cheese stagnation?
No.
Kidney.
Sir,
No.
kidney.
There are only
Calcium.
few. So you tell
Heart.
everything in line. Huh?
Heart.
I did not treat heart.
Sir, kidney.
No.
Tongue.
No, you cannot treat tongue in
Spleen.
TCM. Huh? No, not spleen.
The pericardium?
No, not pericardium.
Kidney? Small intestine, sir.
No,
Small intestine.
not
Sir,
small
SK
intestine.
meridian of Dr. Wall?
No.
Sir, lipid profile.
No, that is a report, not an organ to be treated.
Triple
lungs.
varma?
Huh? No,
Triple varma?
no,
Lungs, sir.
no. There are only no 12 organs in TCM.
UB.
GV?
Huh?
GV?
No, I treated lungs. The treatment given was for lungs. How? Interesting, isn't it?
Yeah.
So the patient's hand and all was like slightly blackish. I put the points in a matter of 5-10 minutes. The hand started becoming like normal, pinkish, the way that normal hand becomes. No, blood started flowing. It was not flowing properly. So it started flowing, and there was so many changes in the patient in minutes. Okay. So it is the power of right diagnosis. How do you understand things and fix it? So then the magical results will come to you. Okay. You want to hear about this, or should I talk about something else?
Talk about this, sir.
Talk about this. Achha, only one person wants this. Others want.
Yes, sir, we want to hear this.
Sir,
No,
we
sir.
do.
Huh?
We all.
What? What? There is a no common consensus.
Sir, we want to learn diagnosis, how you meet all these diagnoses.
Yes.
Huh? Achha, those who are not speaking
हाँ
anything.
सर लर्न करना चाहते तभी तो बैठे हम यहाँ पे लर्न करने के लिए।
We want to learn.
Art of diagnosis, what we want to learn.
हाँ सर वही तो वो
हाँ,
बुक्स में सब नहीं मिलेगा।
अच्छा अच्छा ठीक है.
हम्म।
So here and there Hindi comes out. So so we'll learn little bit about this, and then we will switch to heart. Okay. Fine. So this is super important for all of you to understand. Okay. So we all know the creative and control cycle of TCM, right? So all of us know, but I'll just quickly write it. So heart, small intestine, pericardium, triple warmer. So next is spleen and stomach. So next is lungs and large intestine. Next is kidney, urinary bladder. The next is liver and gallbladder. Right, this is what we have learned. All of us know this. Okay, those You will have to unmute, means mute yourself. Okay. Okay, so we all know this, we have learned it. So I want to draw something different today. And what does this, okay, when you see this figure, what do you understand? What do you understand? Because all of you are in 5th semester, means you are slowly getting into the therapist category, right? You are no more juniors. You are slowly getting into senior semesters, and those who are seriously looking into this as a therapist, they go into higher semesters. So when you see this, what do you understand?
Sir, there is a creative cycle you made
Hmm?
and a
And
controller
controlling
cycle
Sarah.
Rolling
at
cycle.
the same time.
No, that is part of book which you have learned,
And
but I want you to think
transfer of
little bit
energy
more
के लिए sir.
deeper and
Sir, all the organs are more or less dependent on each other or
uh,
connected to each other.
yeah, so all the organs are dependent on each other.
Each
Say
other.
if you say, if you take liver, right? Liver has an arrow to the heart, right? It is connecting to the heart.
Heart.
And okay, I'll write it in another color. So imagine liver. So liver has a connection to heart. So there is a connection between liver and heart. And similarly, there is a connection between kidney and liver. Like this line shows that
Yes.
there is a connection between kidney and liver. And
Liver.
similarly, this line shows there is a connection between kidney and spleen. And similarly, this line shows there is a connection between liver and lungs. Okay. And
Yes.
similarly, it shows that there is a connection between liver and gallbladder. And similarly, you will have to write another arrow. I will write another arrow in a different color. So this is for both yin and yang organs. Okay. So yin organ is connected to yin organ and yang organ is connected to the yang organ.
Mm.
Making sense, right? What I'm trying to say. So this shows for every organ to work, there is a dependency of other organs also in it. Isn't it? Yes, no?
Yes. Yes.
Yes, sir.
So when there is a disease in one organ, it doesn't mean that we have to treat that
Only
organ
one.
itself to fix the problem. Now, this is where your understanding, the depth of understanding will come. Okay. So say there is a problem in heart. An ordinary therapist, what will they think? I will treat heart because the problem is in heart.
Heart.
But a therapist who is skilled, they will think in a different way. They will see which organ is causing a problem in heart. Which organ is causing a problem
Heart.
in heart, and they will
Heart.
treat that organ. Isn't it? Is that the right way to think or
Yes.
the previous way? What do you say?
I think
So
yes.
now
The
we will
cause of the problem.
cause of the problem. So I will write a different, slightly different diagram, and we will see. let's say this is, okay, I'll write it in this way. I'll simplify it. Okay, so this is, let's say this is hard, in terms of the energy, if it is fire. Okay, so this is wood, this is fire, this is earth, this is metal, and this is water. Now, about let's say 60%. Let's try to make it simple. Say 60% of the fire is managed by what? It is, let's say, heart/small intestine. So it manages, let's say, 60% of the fire. And what about the remaining 40%? So let's divide it into 4 parts. So it is liver, gallbladder, kidney, urinary bladder, spleen, stomach, lungs, and large intestine. Let's say this is not from book. I'm just making you some random numbers I'm giving, simplify. So 10% each. So this 10%, this 10%, this 10%, this 10%. This pair is managing some function of heart. Say liver gallbladder is controlling, say, some 10% of the functioning of the heart. Kidney UB is managing 10%. Spleen, stomach is managing 10%, and lungs, large intestine is managing 10%. And overall, heart and small intestine is managing, let's say, 60%. The percentage can be different, but there is an involvement of all organs in making the heart and small intestine function properly. Yes, no. Everybody agrees to this?
Yes.
Yes, sir.
No, everybody is not responding. Only one or two.
Yes, sir. Yes, sir. Yes, sir.
Yes, sir. Yes, sir.
All of you have to at least make that effort of unmuting yourself and telling yes, no, or something like that, right? Still, it was a very response which was not up to the mark. Do you agree? Everybody agrees?
Yes, sir. Yes, sir.
Yes, sir.
Yes, sir.
It is not a resounding yes. It is a very, very feeble. Okay, everybody agrees to it?
Yes, sir. Yes,
Yes.
sir.
Yes, sir. Yes, sir.
I am not.
Yes, sir.
Okay. Okay, some person is saying Anil Singh. Okay, someone is not agreeing. Which semester Anil Singh is? Second semester. Okay, so you will have to spend a little bit more time. Like this is 5th sem class, so you will slowly understand. Okay, so next, similarly, pardon? Yes, somebody spoke.
रिपीट दिस ओनली शॉर्ट टाइम एक्चुअली मैं अभी ज्वाइन किया हूँ तो ऐसा नहीं है मेरे को समझ में नहीं आएगा मैं 6th सेमेस्टर वाला भी समझ लूंगा सर
हाँ ठीक है तो so because it will take time to repeat the statement. You watch the recording. Okay, fine. Next is, okay, instead of me asking, do you agree to it? I say this is how it will work. Okay, so you take it. And next is earth. So let's say 60% of it will be managed by spleen and stomach. Okay. Now, let's say heart has to function. Okay. For those who are not, if the heart has to function, I'll take some simple. I have written, say, 10% of lungs and large intestine. The blood from heart goes to lungs.
Yes.
Right? From
Yes.
right ventricle, it goes to the lungs.
Lung. Lung.
And then there, the blood is oxygenated and comes back to left atrium. Right? For heart to function, the function of lungs is important or no?
Yes.
Important.
Yes, no?
Yes, sir. Yes, sir.
It is
Yes.
important.
Right? So now if I have written 10% for heart to function, the lungs function is also necessary. Is it wrong?
Yes.
Yes.
Is it wrong or right?
Yes, sir.
Right?
Right.
More than that.
Right?
More than that percentage.
More than that.
Don't go by percentage. I'm only trying to make you understand the concept. Right?
Yeah.
Now you eat the food, and the food has to be digested to create the blood. Right? So spleen's involvement is required or not? Spleen and stomach?
Required.
Yes, it is
Required,
required.
sir.
Yes, no?
Yes, sir.
So can I say the spleen, the heart's function is incomplete without the involvement of spleen and stomach? It is a
Spleen.
correct statement,
Yes. Yes.
isn't it?
Yes. Yes, sir.
Anil
Yes, sir.
Singh is understanding.
Yes,
Anil
sir.
Singh is
Yes.
understanding. Right?
Yes, sir.
Okay. So this is what is being told here. Now, I gave this example from allopathic view, anatomy physiology wise. I told, okay, blood from heart goes to lungs, gets oxygenated and comes back. So the heart's functioning is dependent also on the lungs.
Lungs also.
Right. I told this because you know this from anatomy physiology. But TCM doesn't stop there. TCM's involved, it is more at an energy level. So the way the TCM sees the human body is so much different from the way other systems see the human body. Either it could be Ayurveda, homeopathy, or Siddha, or any other system. The perspective with which you see the body is very, very important. Okay. Say, I'll give you an example. Now, what do you see? This is a pen. Okay. Now, if I hold the pen like this, you will see something which is long and thin. Okay. But if I hold the same pen like this, what do you see?
Round circle.
You see something which is round and
Very
thin.
small.
It is not long, it is circular. Right?
Yes.
So, which is right? The first one is right or
Both.
second one is right?
Both are right.
Both are right,
Both are right.
but
Both
we
are
have
right
to select the
both are right
corresponding.
in its own way. Right?
Yes.
So how you see the pen? You are seeing like this. You see something white over here, right? But if I turn the pen like this, you don't see the white. One system says there is white color on the pen. Another system says there is no white color on the pen. Are they right?
Yes.
Yes.
Both are right, depending on their view. Yes, no?
Yes, sir.
Yes, sir.
Yes, sir.
Yes, sir.
Right. So in allopathy, there is probably, they say, if there is a problem in heart, treat heart.
Right.
In TCM, it says if there is problem in heart, see which organ is influencing that functioning of heart and treat that organ.
Yeah.
Making sense?
Yes.
Okay. So this is how the TCM sees the human body. So it is quite different, and you also have to learn to see the human body like that. Okay. So apart from the percentage, you try to understand the concept. Now, so give me a moment, please. Okay. So once again, the percentage is not important, but the concept is important. So other aspect, the functioning of the earth is the digestive process. Say, heart, small intestine, let's say 10%, and kidney, somebody is say there, if there is any voices, please mute yourself. Kidney, you be 10%. Lungs, large intestine, 10%. Liver, gallbladder, 10%. Okay. So similarly for metal, so let's say lungs, large intestine, 60%, and the remaining 10%. It could be 40, 15, 15, 15, or any other number. So it is heart, small intestine, 10%, kidney, UB, 10%, liver, gallbladder, 10%, spleen, stomach, Radharani. Have to keep yourself muted. So spleen, stomach, 10%. Okay. Water, kidney, urinary bladder, 60%. And the remaining organs, heart, small intestine, 10%. Liver, what happened? Just give me a moment, please. Okay. So, liver, gallbladder, 10%. Spleen, stomach, 10%. And lungs, large intestine, 10%. Fine. And then in wood, liver, gallbladder, 60%. Heart, small intestine, 10%. Spleen, stomach, 10%. Lungs, large intestine, 10%. And there is a interconnection of all all of them. So there is a interconnection between all of them. So does this make sense?
Yes, sir.
Interesting. Now this, when it sits in your mind properly, then understanding TCM becomes easier. Okay. So for sometimes there is high BP, so we will treat liver. Sometimes there is high BP, we will treat lungs. Sometimes there is high BP, we will treat kidney and UB. So how does it make sense? So then you will understand, if this concept is very strong within you, then it becomes easier for you to understand. Okay. Up to this point, everybody is okay? Any question?
Yes.
Okay, sir.
Okay. Others?
Yes, sir.
Yeah. Yes, sir.
Yes, sir. Yes, sir.
Okay, sir.
Okay. Fine. Fine. So
Pericardium triple warm.
don't get into that as of now. The space is small, so I have not added pericardium triple warmer. Okay. It also involves, but I'm trying to not make it too complicated as of now. You digest this later on, it can be worked upon. So this is a new way of interpreting the creative and control cycle. Okay. So now let's take, how should we go about, we will have to discuss treatise 11, okay, which is specific to heart. So how do I go about it? So I'll take some concepts and teach you, or how do you want it to be taught?
Yes, sir, it will do.
We'll take some diseases and then discuss based on how Kemka sir has taught in this. Okay, works fine.
Yes, sir.
Okay. So we will take blood pressure, okay, high BP, low BP, and then we will discuss it. Fine.
Okay, sir.
So what is BP? So we will take blood pressure. Somebody's system is unmuted, so keep yourself muted unless you are speaking. Okay. So blood pressure. So in that there are two types, high and low. Okay. So what is blood pressure? Tell me, anybody wants to say what is blood pressure? What should be the standard BP?
Systolic and diastolic.
120
by 80. 120
120 by 80.
sorry, systolic and diastolic is 80.
Okay,
The
120
pressure
by
with
80.
which the blood comes to the heart is, and the pressure with the amount it goes out from heart to different organs.
Repeat it, Manish ji.
The pressure by which blood enters into the heart is diastolic, and the pressure with which the blood goes out of the heart to other organs. Means deoxygenated blood, systolic. Systolic is the from heart to organs, and diastolic is from uh, different organs to heart. Means
When heart pumps the blood, some blood is pumped away and it's going to the organs. The remaining heart blood which is going on after the pumping, it's a diastolic pressure.
It is the pressure applied where?
Arteries,
Ah.
aorta.
So it is the pressure on the arteries, right?
Yes.
So what is blood pressure? Say this is the, let's say, heart. It has 4 chambers. What is the heart doing? It is pumping, compressing and relaxing. Okay, just a moment. So there are 4 chambers and there is arteries coming out. So this is the blood will come out of the artery. Now when the blood is coming out from the artery, it is a pipe, isn't it? So there is some kind of pressure exerted on the pipe. The blood is flowing. So what will happen? There is some kind of pressure exerted on the walls of the arteries. Yes, no?
Yes.
The blood is flowing. So I will write it separately. So this is your artery and the blood is flowing. And the blood is flowing. Okay. And this creates some kind of pressure. This creates pressure on the walls of the arteries. Okay, pressure on the walls of the arteries, right? So there are 2 stages. One is when the heart is compressed. Compressed is called as, when the heart is compressed, it is called as systolic. Compressed is compressed is systolic. And when it is relaxed, it's called as diastolic. Okay. So when it is pressing, more blood is coming out and there is more pressure. And when it is relaxing, there is less blood in the arteries, so there is less pressure. Compression, there is more pressure. Relaxation, there is less pressure. So when the compression is supposed to happen, it should be about 120 units of pressure. And when it is relaxing, it should be about 80 units of pressure. Okay. So that is where, from where this 120 by 80 coming. Right? So 120 units of pressure when it is compressed and 80 units of pressure when it is relaxed. So this is a like standard universal standard, but it doesn't have to be the same for everyone. There will be some amount of plus minus 10% or 15% for different people based on their body composition. Okay. Now everybody understands the pressure. What is blood pressure? What is blood pressure?
120/8.
No. What
Pressure
is the what is
regulated by blood on the walls of artery.
Pressure on the
uh,
contracting and
Walls of the arteries.
blood pressure is the pressure
Is to be given by art.
exerted on the
walls of the
walls of the
arteries.
arteries. Blood pressure is the pressure exerted by blood. Okay, I will write it in this way. On the walls of the arteries when flowing. When flowing through it. Okay. Clear?
Yes, sir.
Okay. And it has two levels, and it has two stages of pressure. So this blood pressure has two stages or two levels. Has two levels.
High blood pressure or low blood pressure?
No. While compressed and while relaxing.
Relax.
When compressed, it is systolic. Second, when relaxed, it is diastolic. Okay. So now this 120/80 is the standard Now if this is the this is the normal standard. Okay. Now if the BP goes higher, so it has a range of, let's say, plus minus 10% or 15%. Now if this goes beyond that, say if it is like 170 by 100 or more, okay, if it is going towards this, okay, then it is called as
high blood pressure.
high BP, high blood pressure. The number may not be accurate, but I'm only trying to tell you the concept. Okay, it may be different. High blood. Okay, it may be 160 also. 160. And if it is going like this, and if it is coming like this, say if it is 70 by 40, something like this, then it is
Low
low
BP.
blood pressure. Okay, it could be, let's say, let's make this as 50. Don't go by number, but the pressure which is exerting on the wall is less, then it is low BP. If it is putting too much pressure, then it is high BP. So in what all situations can this high pressure and low pressure happen? Okay. Up to this point, everybody is okay?
Yes.
Yes, sir.
Yes, sir.
Okay, should I continue
Yes,
in this way itself?
understood, sir.
Should I continue
Yes.
in this way itself?
Yes, sir.
Yes. Okay. So it is very similar to how is this happening? Heart is a pump, right? So how do you understand the? You all know, Dhanlakshmi ji, you keep yourself muted when you're not speaking, okay? Because when you move your book, etc., that sound will come, okay? So what is a pump doing? So pump is transferring the, like in your house, you will have water pump, right? What does it do? So there is a, let's say there is a pump. So there is one inlet to the pump. Okay. And there is electric wire to the pump. And there it is in the wall, in the plug. Electric supply. So this is the inlet. Say there is a tank. And in that tank there is water. Okay. Okay. And then what happens? Then there is an outlet. So there is a, here there is an inlet and there is a outlet. And there is a electric supply. And this is electricity. Okay. Right. And whenever there is a liquid which is flowing within a pipe, you all would have seen your rubber pipe in the house, which you connect to the tap, right? So when the water is flowing, so there is a movement. Like, how do you see when the water is flowing in the river or some stream? How is the water flowing? It is flowing like this. There is a wave, right? So whenever there is this part, so imagine the same is happening inside the
Blood flowing in the arteries.
in the arteries. What happens whenever it is touching the arteries? So it is not a hard pipe. The arteries, it is a made out of, it is a soft pipe, right?
Flexible.
So when it is a flexible pipe, so there is, whenever there is small extra pressure, what happens to the surface of the pipe? There it slightly expands and contracts. Expands and contracts. Making sense? Whenever there is extra pressure, it expands and also contracts when there is less pressure. Okay, so there is some amount of flexibility in the pipe. So when there is flexibility, so this is the flexibility of the, I will say, vessels. Vessel is both arteries and veins. Arteries plus vein. veins. Okay. So now tell me, when the flexibility becomes less, that is when the pipe is rigid, will the pressure on the pipe becomes high or less?
High.
Huh?
High.
When the pipe is
Less.
rigid, the pressure will be more.
Rigid, if the vessel becomes rigid, then what will happen?
The pressure will be more.
Pressure
लेस
is
हो जाएगा क्योंकि वो जगह कम हो गई है ना उसमें,
what?
लेस हो जाएगा उसका प्रेशर, उसमें जा नहीं पाएगा उसमें अंदर क्योंकि वो जगह
Pressure
नहीं.
पाइप रिजिड हो गई है ना
artery
तो
में
Rigid. If the pipe is rigid, what will happen to the pressure?
लो हो जाएगा ब्लड प्रेशर
नहीं,
हाई
क्योंकि
नहीं प्रेशर ज्यादा रहेगा हार्ट को
प्रेशर ज्यादा
प्रेशर
okay. Why? Because if this is a pipe, if the pipe is expanding, like this part, let's say, what the blood hits, so the pipe is also expanding, so the pressure is less. Now when the pipe hits, this is not moving back. Say in the normal condition it hits, so the pipe also expands, the pressure is less. But when the pipe becomes rigid, when the blood hits, it is not moving. So what is happening to the impact? The pressure is
high.
high. So when the pipe becomes rigid, the pressure is high on the pipe. So pressure increases. And if the vessel is too soft, so if you touch this, it becomes like this. If touch, it becomes the pressure. If it is too soft or too flaccid, what becomes to the pressure? Pressure is
low.
Pressure is
Low.
Decreases.
No.
Pressure decreases. Up to this part, it is correct. Everybody is okay.
Yes, okay,
Yes, sir.
sir.
Yes, sir.
Unmute and say yes, no, yes, no. Everybody is
No.
okay up to this point.
Yes, sir.
Yes,
Yes,
sir.
sir.
Yes, sir.
Yes, sir.
Yes,
sir.
It is not a strong yes. Pressure is less.
Yes,
Pressure.
sir.
Huh?
Yes, sir. Yes, sir.
Understood, sir.
Yes, sir.
Continue, sir.
Low BP. Huh? Low BP.
Yes, sir.
Okay. So when what can cause high BP and low BP, I'm trying to explain. Okay. First thing is the pipe. What are the things which are involved here? It is the first one is the pump. Pump is involved. Second is pipes. Right? So that is arteries and veins. Pump is heart. Okay, third, electricity. What is electricity? The
Nervous system.
stimulation from the brain or the nerves. Okay, nerve stimulation. Let's say brain. So you have your electrical system, bundle of His and no synovial node, like
So, heavy node.
AV node. So all of those are electrical signals or stimulants. And fourth is the content which is flowing inside the pipes. That is blood,
Blood.
right? The content flowing. That is blood. Anything else? These are the fine. Like if you understand in a broad way, later there may be many other things, the minor things which you will be able to understand it, but in a bigger way this is there. So what did we discuss here? We discussed the pipes. If the pipe is rigid or too flaccid, that can create high BP, low BP. Clear? So this is the pipe. We are discussing pipe. Second, let's discuss pump. That is heart. There is more subdivisions to it, but we are not going to that depth as of now. Okay, so pump. Now, if the energy in the heart is sufficient, it can pump with good pressure. Okay, for some reason the heart is squeezing more. Okay, for some reason the heart is squeezing more, then it can create high BP. Yes, no? For some reason the heart is, say
Yes.
for example,
Pressure will be more.
somebody became emotionally hyper. They got very angry, agitated. So what will happen? Heart is pumping at a higher rate. Or they are into a flight and fight mode. So what will the heart do? It will pump more with a higher pressure. Okay, squeeze more. So this thing, when the heart squeezes more, okay, so it can create high
Pressure.
can create high pressure. And when the heart has less energy, slowly it is doing. So when heart squeezes less, then when heart squeezes less, can create low making sense. Heart doesn't have enough energy to pump, so it will slowly do it. So there is less pressure getting exerted on the pipe. Up to this part, everybody is okay?
Yes, sir.
Yes? Only one
Yes.
person said yes. I want
Yes, sir.
unmute,
Yes, sir.
say
Yes,
yes,
sir.
no?
Yes, sir.
Huh.
Yes.
Yes.
I know
Up to this
many of you are
understood.
doing multitasking. Huh?
Yes, sir.
Huh? Right? Yes. Okay. So pipe is done, pump is done. Now, some kind of electricity. Okay. So for some reason, the voltage becomes more. Okay. So pump and electricity. Okay, that is nervous stimulation. Nerve okay. So there is excess stimulation happening. So when there is when excess stimulation, that is emotional state. Somebody is agitated, anxiety. Okay. So, or there is lot of anger. somebody is going through a rage, revenge, those kind of feelings. Okay. So now what is happening when excess stimulation is happening? There can create
More pressure.
more pressure. Okay. Or when stimulation is low, when low stimulation. Low stimulation means there is some issue in the nerves which is passing the signal. So it is not making the heart beat at the right pace. So what will happen when the stimulation is low? What can happen?
The
Pressure
pressure will be low.
can create low pressure. Okay. This part is okay. Simple.
Okay.
Simple. Right. Up to this part, it is simple.
Yes,
Next
sir.
is what? Content. Content in pipe. That is blood. Okay. Imagine the water which is coming from this. Okay, let's take an example. You have a container. You have a container. You have, let's say, 2 containers. So this one container has cold water and another container has hot water. Okay, so this is cold water and this is hot water. Now, which water will exert more pressure on the walls of the container? Cold water or hot water?
Hot water.
Cold water.
Hot water, hot water.
Hot
Hot
water.
water.
Hot water is trying to expand, isn't it?
Yes.
Yes.
Hot water, what does it do? It sits in one place or it tries to expand. There is
It will
steam,
go to
right?
expand.
When there is hot water, what is happening? There is steams are coming out. And now you try to close it. Close the lid. What happens? The pressure is getting built up inside. Yes, no?
Yes.
Yes.
Now,
Yes.
when there is
Yes.
cold water, say imagine ice, what happens? It expands or contracts?
Contracts.
Expand.
Contract.
Ice contracts, right? So when there is contraction, will there be high pressure or low pressure on the container?
Low pressure.
Low pressure, isn't it? So cold water exerts
Less
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 pressure.
pressure.
Less
Pressure.
pressure on container. And when there is hot water, more pressure. More pressure on container. Okay. Now, depending on the quantity of blood and the quality of blood.
Good.
When there is more heat in the blood, say when there is more heat in the blood, that is, so when there is more heat,
high BP.
more heat in blood, so it will create high pressure. Can create
High BP.
high pressure. Okay. And when there is low quantity of blood, whenever we say this heat, no, it is not the thermometer heat. It is the heat of, as per TCM, liver heat or heart fire, that kind of heat. Okay. Full heat, empty heat, those things are there. No? It is that heat, not the thermometer heat. And when there is low quantity of blood. So we will not say low, less heat. We will say low quantity. Low quantity of blood. So if there is somebody is unmuting themselves, Som Prakshi saying. Okay. So when there is low quantity, so if the pipe is there, and in one pipe there is lot of blood rushing. Okay. And in another pipe there is less quantity of blood. So which will have higher pressure? This will have high pressure. And this will have low pressure. Okay. So yes. So low quantity of blood means whenever the quality of the blood goes down, like say body has to maintain about 5 liters of blood in the body. So when the quality, that is the nutrition in the body goes down, what will the body do? It will add water to compensate. It's like milk. No, somebody use, like if it is 1 liter of milk is supposed to be there, but if they use it up, but only say 900 ml or 800 ml milk is there, what will the milkman do? Some milkmen do, so they add water and it will once again become 1 liter. But this water added milk and non water added milk, there is a difference, right?
Yes.
Quality.
The quality is low quality. The quantity is the same. It is low quality. The same thing is happening here also in the body. When the food is less, nutrition is not extracted from the food. So what will do? Body will add just water to maintain the, so low quantity, or I will say quality. Low quality of blood then can create low pressure. Up to this part, everybody is okay?
Okay, sir.
Yes, sir.
Yes, sir.
Yes.
Yes, sir, clear.
Everybody is not
सर
clear.
लो क्वालिटी में क्या होगा ब्लड में?
The low quality,
blood
what
cells.
is the meaning of low quality? Less red blood
This
cells, less oxygen in the blood, hemoglobin will be less, and less nutrition in the blood, right?
Yeah.
Making sense?
Yes, sir.
Okay. So people eat
Sir,
blood thinners.
high quality. Sir, high quality means
What? Repeat the question.
high quality blood means what is the meaning, sir?
High quality blood means, what is blood? Blood is what? Blood is
Mm,
equal to red blood cells.
White blood
Red
cells.
blood.
white
Okay,
blood
I will
Plasma.
write it.
cells.
What blood is? RBC,
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 WBC,
WBC,
WBC plus
platelets,
plasma,
plus plasma,
platelet
platelet.
plus plasma.
plasma.
Like these are the three cell types, right? These are cells, and this is
That
the
is fluid.
liquid in which
Fluid.
the cells move around. So this is the liquid. So what is the content of the liquid? Is it just water or it has nutrition?
It has a nutrition.
What is there in this liquid? Water plus
Water plus nutrition.
nutrition. Okay. Now in this, in a simple way, high quality blood is high nutrition.
High nutrition.
High nutrition is equal to high quality. Okay. Low nutrition is
Low quality.
equal to low quality blood. Okay, in a very simplistic way. Make sense? Dhanalakshmi ji, is it making sense?
Yes, sir.
హై క్వాలిటీ మంచిదే కదా అని నా డౌట్.
What?
హై
Repeat.
క్వాలిటీ అంటే అది మంచిదే కదా, బ్లడ్ క్వాలిటీ.
He thinking that the quality of the blood is good when it is high quality.
Now, when the nutrition in that liquid is, say, blood, you imagine like this. So, there is a container, and in that there is, say, some liquid. Okay, and there is, this is RBC. Okay, and if there is, I will not write. Okay, imagine this to be platelets. Okay, and this is, I can't write it in white, so I'm trying to write in WBC. And this blue thing is your plasma. So this entire thing is blood. Okay. Now, what is the major part in blood? Plasma, WBC, RBC, platelet. Which is more? Plasma is more. Right. So I'm only giving you the example of plasma. In that, if there is high nutrition, high quality of blood, low nutrition is low quality of blood. Now, similarly in RBC, if there is higher number of RBC, and in that, what does the RBC carry?
Hemoglobin.
Hemoglobin. RBC has hemo is iron, and globin is like oxygen it carries. So higher amount of hemoglobin and higher amount of oxygen means what? If this is high, is equal to high quality blood. And if it is less, low quality blood. Making sense?
Yes.
Yes, sir.
Yes, sir.
Right?
Yes, sir.
Similarly in WBC and similarly in platelet. So in RBC, it should be like proper circle, right? RBC should be proper circle. It is a good RBC. But if it is like this or like this, so this is low quality. Low quality RBC. This is very low quality RBC. Making sense? Some Bharat Kallimani. Everybody is okay? Anybody not okay? Tell me.
Okay, sir.
Yes, sir.
Okay, sir. Understood, sir.
Yes, sir.
Yes,
Nice.
sir.
सर
Yes, sir.
Okay, sir.
सर एक क्वेश्चन और है सर. सर
Mhm.
जैसे मेरे हस्बैंड का ब्लड ग्रुप ओ नेगेटिव है, तो इनको हर 3 महीने में या 2 महीने में ब्लड डोनेट करते हैं सर. बट इनका बीपी हमेशा लोअर साइड पे रहता है और सोडियम भी कम रहता है. तो ब्लड देने के पहले तो हमेशा ब्लड की जांच होती है. तो सर वो हमेशा इनका पॉजिटिव आता है तभी ये ब्लड डोनेट करते हैं. तो हम कैसे बोल दें कि ब्लड अच्छा नहीं है इसलिए लो बीपी हो रहा है सर?
No, repeat the question. Repeat कीजिए.
हाँ जी सर, इनका बीपी हमेशा लोअर साइड पे आता है और ब्लड ग्रुप ओ नेगेटिव है, तो इनको हर 3 महीने में या 2 महीने में ब्लड डोनेट करना होता है, इमरजेंसी आती है।
your husband donates blood to others
यस सर।
approximately every 3 months. Okay, even though he has low BP. Okay,
हाँ सर,
okay,
एंड सोडियम भी लो हो जाता है सर। तो
okay.
मैं ये बोल रही हूँ कि मैं ये पूछ रही हूँ सर कि यदि ब्लड की क्वालिटी अच्छी नहीं होगी तो फिर वो कैसे ब्लड डोनेट कर पाते हैं?
Okay, so her question is her husband has the situation where he has to donate blood to others almost every 3 months. Okay, and now he generally has low BP, but he is donating blood means he has good quality of the blood. That is why others are accepting the blood, right? That is the question. How can it still have low quality? So what is the answer? The high BP, low BP is not only decided based on the quality of the blood. So what have I written? It is decided based on multiple factor. How is the pump? Heart, how is it? How is the pump functioning? How is the pipes functioning? How is the electricity? And fourth one is the content. So the content is good. The content is good in your husband's case.
Blood.
But what about the other three? One of the three may be not good. Okay, that is why the person has low BP. Okay, clear?
ओके सर।
Huh? Everybody is okay up to this point?
Yes.
Yes, sir.
Yes, sir.
Yes, sir.
Yes, sir. Now, how do we treat these conditions in TCM? Is the question. So we will, okay, I'll write here itself. Okay, we'll take this. Whenever there is, I will open the chapter. So for high BP, Kemka sir writes, these are the causes. So causes for high BP as per TCM. I gave this analogy for you to understand like in a broad, rough way. Okay. Now, as per the book, what sir is giving. Okay. This is chapter 5. High BP, hypertension, page 24. Okay. So causes उसको क्या okay, it is also called as hypertension. As per TCM, traditional Chinese medicine. Okay, so sir says there are five reasons for high BP. Five causes of, that is once again as per TCM, not as per allopathy, as per TCM. First one, liver fire ascending, that is liver heat. Liver fire ascending or liver heat, liver fire. I'll just liver fire. Now, which category does this come into? Out of all of these four things which I have written here, pump, pipe, electricity, content, liver heat comes under what? Hmm?
Electricity, sir.
Heat in
नहीं,
blood.
सर कंटेंट में आना चाहिए सर.
हाँ.
कंटेंट.
What is liver?
केमिकल फैक्ट्री है सर.
It is a chemical
So,
factor
like I
of
will
all
write. So
enzymes.
this tank of blood. Okay, this is water tank, right? In this example, this is water tank. Water tank. In our body, which is the tank for blood? Where does
Liver.
blood?
Liver.
No, tank. So our
Liver.
body has
Liver.
our body has about 5 liters of
Blood.
blood circulating in the body, and in that about 1.5 liters of blood is stored where? In
Liver.
In
so
liver.
liver is the water tank. Liver is
Water tank.
blood tank, we can say. Can I say blood tank?
Yes,
Yes.
sir.
Blood tank. Okay, so it holds 1.5 liters of blood,
Blood.
approximately 1.5 liters of blood. Now, if the tank becomes hot, what will happen to the contents of the tank?
वो evaporate हो जाएगा.
Pressure will be more.
That will also become hot. Yes,
Hot.
no?
Some heat
Yes.
will be
Blood.
When-
Blood also.
coming from the liver.
Yeah, the
Yes, sir.
liver is becoming heated. What will happen to the contents of the liver?
They
Hot.
also be
It will also
hot.
become hot.
Hot.
So what will happen? The hot water is there, means what will happen? There is more pressure on
Pressure.
the container.
Hmm.
Understood?
Yes.
Right? So liver heat is one cause of the high BP. So if there is liver heat or liver fire, what do? You give the liver heat protocol. What is the liver heat protocol? What is the
Liver
liver
2,
heat?
3, B30.
Pre-sedate.
So liver heat protocol is. Should I write
Liver
the
2, 3.
protocol? It is there in the book, no? You can.
Yes.
Should I write it? It is there in the book. Liver heat rising. So it is.
Pre-sedate for
Liver.
Liver 2 3 GV30
Liver 2, liver 3,
20 LU5
gallbladder
UV
30,
18 19
gallbladder 20, UB 18,
and 19.
UB 19,
Sedate all.
liver 14. All of this has to be sedated, and lungs 5 and liver 8
Tone.
has to be toned. And how do you know this is because the fire is there in the liver? The person will have lot of anger, eyes will be reddish, tongue will be long, and sides will be more redder. And when there is lot of heat, what will the person do? They will drink lot of water to bring down the heat.
drink.
So, and they will not drink water in sips. They will gulp it. Okay. So
Hotness symptoms are seen in that person.
these symptoms will be there. And then you will know that there is liver heat and you give this. Then what will happen? The liver fire will come down and the blood pressure will also
Come down.
simple. Everybody understood it?
Yes.
Understood?
Yes.
Understood.
Yes, sir.
Low
Yes.
BP, low response.
Yes, understood, sir.
Yes, sir.
Uh-huh.
Yes, sir. Understood.
Sir, excuse me, sir.
Yes.
सर ये ग्रुप 1 में लीवर 2 GV34 एंड TW17 क्या ये भी अप्लाई करने हैं?
See, sir has given different group 1, group 2, etc. But you understand the concept. You can work around with the points. Okay. Some points may be here and there, but these are some standard points. For some people, there may be some points which are plus minus. You
Okay, sir.
have to manage it. So,
सर ग्रुप 1 और ग्रुप 2 कब दिया जाता है? अलग अलग कब देना है और कब एक
so
साथ देना है?
you try group 1. If it doesn't work, then try group 2. Okay, because
Okay.
there are different types of patients, so sir has segregated it. Okay. So second cause is deficiency of yin causing excess yang.
सर तो हमें कितने दिन तक लगाना चाहिए ग्रुप 1?
See, this heat part is generally like few months, 1, 2, 3 months, anywhere between 1
नहीं
to
नहीं सर, नो सर, यदि इसको वर्क नहीं कर रहा है फर्स्ट वाला प्रोटोकॉल, तो हम कितने दिन लगा के ट्राई करें कि वर्क नहीं कर रहा, फिर
2 days
सेकंड वाला
to less than a week, maximum 1 week. 1 week you
Okay.
apply maximum. I am telling. Okay. My theory is you apply instantly the result should come. I told 10 minutes 40% reduction,
Yes. Yes.
right? So if
Okay.
the diagnosis is spot on, like pinpoint accuracy in diagnosis, and the result should come in less than 15 minutes. But if you are still new and you are not sure, 1 week you can give maximum, and in 1 week if the result is not coming, then in 1 month
And
also
change the
there is
product.
result will not come. Okay, after 1 week you can change confidently. Some result has to come, like noticeable result has to come within 1 week, right? So if nothing is happening, there is no point continuing in that protocol. Okay, it only means that the diagnosis is wrong or the point location is wrong. Like when you are applying the point, if the point locations are not correct, then also result will not come. Even though diagnosis is right, point location is wrong, then result will not come. Okay. Or instead of tone, they are doing sedate, or instead of sedate, they are doing tone. Any of those mistakes are done, then also result will not come. Okay.
Okay,
If
sir.
everything is right, 1 week is
Yes, sir.
it is maximum time within which the result has to come. Okay.
सर अभी आपने इसमें कहा था कंटेनर इज हॉट, मतलब अगर गर्म है कंटेनर तो लीवर हार्ट के सिम्टम्स हैं, पर किस कारण से गर्म होगा?
See, this is second semester question. See, for everything, there are so many causes, right? So if I go into the causes, I'll not be able to cover. See, what are the causes? What goes into liver? If somebody drinks a lot of alcohol, what will happen to the liver? It will get cold
Smoking.
or hot. It will get hot. And somebody's
Spicy food.
Sir,
eat lot of
tension is also reason.
Yes.
excessive
Yes. Yes.
tension. Somebody eats
Stress.
lot of spicy food,
Yes.
right? And there is lot of friction happening. There are so many causes, and all of that
Sir,
is
एटमॉस्फेयर भी causes होगा इसमें.
it can be
Hot as
if somebody is working
Yes.
in a bakery inside as a chef, very close to the stove
Fire.
long times, or somebody is working in hot environment for long time, their liver also can get hot. Or somebody is taking lot of medicines, so and it gets processed in the liver, so that also can create heat. So by nature, somebody's constitution is excess in liver, so those people also can have excess heat. Okay, so many
Okay.
causes. Okay.
Okay.
And if the kidney no, see, let me finish this. I can, because if I take questions, time is already, I only have 6 minutes left. At least let me complete this high BP. Okay. So just listen, no questions for next sometime. Okay. Next is deficiency of yin causing excess yang. Okay. So some people have to mute. What is happening in this situation is, see, there are two situations. Whenever the organ is functioning, it generates heat. Say function is like when you are rubbing, what is happening? This is function. Simultaneously, what is happening? The heat is getting created. So any function in the, say a bulb is functioning, So you touch the bulb, there is heat.
Hot.
Right? The TV is functioning. Then you touch the TV. What is that? It is hot. Right? Your fridge is functioning. Touch the outside of the fridge. It will be hot. Anything which is functioning, mixie is functioning, you touch it, it will be hot. So anything which is functioning will create heat. Okay. Any function, any organ functioning, what it will do, it will create heat. And to manage that heat, what will be there? The water will be there. Right? In the engine, when the engine is functioning, what happens? Heat gets generated. To manage that heat, there will be radiator. Right? In the radiator, there will be coolant or water which is flowing. So that water will absorb the excess heat. So there will be water supplied to manage the heat. This water and heat will be in a right balance. Okay. Now, if the water becomes less in the radiator, okay, if the water becomes less in the radiator, what will happen to the heat in the engine?
Heat is excess.
The heat will increase or decrease?
Increase
Increase.
and falls on the
The heat will
other organs also.
the heat will increase when the water reduces. So this is what is being told here. Deficiency of yin. Yin is what? Water. And yang is what? Heat.
Heat.
Okay. In simple way. So yang has more meaning, but I'm trying to make you simple. When the water goes down, here the actual heat is increasing. In the liver fire, actual heat is increasing. But here, what is happening? The water is decreasing.
Water is decreasing. Yes, that's right.
Right? So
Yes.
this is heat is increasing. Heat is increasing. Hence, the actual heat is there, or actual heat is, I will write. So I will extend the class by 10-15 minutes. Is it okay?
Yes.
Yes, sir.
Yes, sir.
Yes. Yes, sir.
Okay, I will write it in this way. You will not understand it if I write it. Okay. Okay, here imagine there is a container. So this is the amount of water which is supposed to be there. Okay. So this is the normal amount of water. And there is the fire should be okay. So now let's write it. Say 10 units of water. 10 units.
थोड़ी रह जाएगी चम्मच तो दे दे
So 10 units of water and 10 units of fire. 10 units of fire. Okay. So the water will get boiled in 10 minutes. Water boils in 10 minutes. Clear? So there is 10 units of water. So I put 10 units of fire. So the water boil in 10 minutes. This is, let's say this is normal. Now I keep the water 10 units. I keep the water 10 units, but I will make the fire what? I will make the fire as 20 units. Okay. So what am I doing? I am making fire is equal to 20 units. And the water is still 10 units. Water is equal to 10 units. Now the water will boil in how many minutes?
5
30
minutes.
minutes.
Boil is equal to 5 minutes.
5 minutes.
Okay. And what is the cause of this? Excess actual fire.
Excess fire is given, so time is less.
So this is called as full heat. Okay. Now the second situation is I will reduce the water. I will reduce the water and still maintain the 10 units of fire. Okay. Here, what is the situation? Water
Reduce.
is equal to 5 units. And fire is equal to 10 units. So boiling is here when will it boil?
30 minutes.
5 minutes. Here also water will boil fast.
Fast.
Yes.
Right. But this is not because of the excess heat. Here the boiling is because of
Steam deficient.
less
Less
water.
water.
Less water.
Less water.
Right. So this situation where the boiling is happening fast due to less water, it is called as empty heat.
Empty heat.
Empty heat or indeficiency. Okay, understood?
Yes.
So in the first situation, liver heat, this is the situation where the fire is actually more. And in the second situation where the yin is deficient, which is causing the excess yang, this is the condition. Making sense?
Yes, sir.
Very
Yes, sir.
low, yes.
Yes, sir.
Yes.
Yes, sir.
Yes, sir.
How many of you did not understand? How
सर
many of you-
एम्प्टी हीट एक बार और बता दीजिए प्लीज.
Empty heat is when the heat is not because of the heat. When the heat is because of the actual heat, it is called as full heat. But when the heat which is not because of the heat, but because of the less water,
Water.
that is called as empty. There is no actual fire. It is an empty fire. Okay.
Okay, sir. So may I ask something?
Quick.
So
Yes.
all deficiency is empty heat, or there are other reasons also for yin deficiency?
No, repeat the question.
Sir, as you told in the last statement was that when the because wind is less and fire is equally the same amount and water is less, so it's empty heat.
Hmm?
So and then you told it's yin deficiency.
Hmm.
So, yin deficiency only means empty heat, or there are other things also to be included in yin deficiency, or other reasons also for yin deficiency?
Empty heat is equal to indeficiency.
Yeah, empty heat is indeficiency, but only empty heat is indeficiency, or
No. Your question is only when water is less, is that indeficiency, or when something else is less, that is also indeficiency. Is that the
Yes,
question?
yes.
no, no, sir. Lack of fluid is indeficiency. I know this,
Hmm?
but it's like
Other
may I
other causes.
No. Let her post your question.
बाकी जैसे पैरामीटर्स ठीक हो जैसे फायर ठीक है
Hmm?
और फायर ठीक है और सिर्फ ओनली फ्लूइड कम हुआ है
Hmm?
तो वो मतलब एम्प्टी हीट या जैसे जो पहले वाला सिचुएशन था उसमें भी फायर पानी जल्दी से फ्लूइड कम हो गया था फ्लूइड वाज लेस इन कंपेयर टू वाटर व्हेन इट
Okay.
वाज फुल हीट
No. Okay. Try to understand this. So now 10 units of water is there and 20 units of fire has become. Okay. Now the water is boiling and getting evaporated. And after some time, what will happen to the water? it will further go down and it will boil more. Slowly, the full heat condition is converting into
Empty heat.
empty heat. Is
Yes.
this the question that you had? No, you are muted.
So full heat is also yin deficiency.
No. Full heat is not indeficiency. Full heat is excess heat.
Excess. Okay. For
And
full heat, we'll call it excess heat. And
yes,
when it will empty heat will come, then we will call it yin deficiency.
yes.
Yeah. Now
So,
I got it.
okay, fine.
Thanks a lot, sir.
Welcome. So now, deficiency of yin causing excess yang, right? So what do we do here? So we will treat the deficiency of yin in which organ? So if there is deficiency of yin in kidney, we will treat kidney indeficiency, right? If yin deficient in kidney, if it is in kidney, treat kidney indeficiency. So I will not give the points, it is there in the book.
Yes.
Kidney yin deficiency. If the yin is deficient in heart, we treat heart yin deficiency. Water is less in heart, water is less in kidney. And if the same is in lungs, so we treat lungs yin deficiency. If the same is in, say, small intestine, we treat small intestine yin deficiency. If the same is happening in stomach, we treat stomach yin
deficiency.
Understood or difficult?
Yes, sir.
Difficult?
Sir, there's one thing, deficiency of yin and yang both.
No, hold on. We are going step by step. Is it making okay?
Yes,
is
sir.
it
Yes.
okay up to this part? Fine.
Sir, where can we find small intestine lung indeficiency?
Okay, small intestine indeficiency. The point is, I don't know where to find. I'll write the point. SI2, SI4, UB27, CV4, SI5. Because this is deficiency, the point will all be tone. Okay? Clear?
Sir, SI में भी yin deficiency होती है?
Yes.
Because sir told me all the yin organs have yin deficiency and one yang organ, that is stomach, have only yin deficiency.
SI also has yin deficiency.
Okay.
Okay. Which sem are you in? And you have to unmute. Huh?
The points की shift करने से
Fifth sem. अच्छा, okay.
condition ये yin deficiency कैसे?
Yeah.
These points are sir yin deficiency.
This is for small intestine indeficiency.
Okay, sir.
Okay. I will not write it is because it's there in the book. So what is the next one? Obstruction of phlegm and dampness. Obstruction of phlegm and dampness. Obstruction of and dampness. Okay. Now, what is this obstruction of phlegm and dampness? Say you have this, your vessel, that is your arteries. And the blood is flowing. Okay. And the blood is flowing. And if there is an obstruction, like there is a clot or some kind of situation where there is some kind of obstruction in the flow. So there is, let's say, a clot. So what will happen to the blood? It will get squeezed. The blood will get squeezed and it will come out with So whatever pressure that it is getting applied over here and whatever pressure which is applying here, so will it be the same or different?
Different हो जाएगा sir.
Different, sir. It will be more.
You have your pipe in
More.
the garden pipe, and if you have to send
It will be more.
so you squeeze the pipe, what will happen to the force with which the water is coming? It will come with a
More force.
higher force.
More force.
It will come with
But
higher force, right? So the same is happening. The blood vessels lumen, that is the size, is reducing. So the blood will come with a higher force. So here it is normal pressure. And here it is higher pressure. Okay. Now, if this is causing a high pressure, high blood pressure, so what do? We treat the clot. We try to reduce the clot. So this is clot is what? Either it is a phlegm or dampness. Okay, depending on the organ where the phlegm is there. If the phlegm is there in the lungs, we will treat lungs. And if the phlegm is or dampness is more in spleen, we will treat spleen. If the phlegm or dampness is more in the heart, we will treat heart. And if it is more in large intestine, we will treat large intestine. If it is more in small intestine, we will treat small intestine. If it is in kidney, we will treat kidney, UB. So depending on which organ it is there, so we will treat that organ. And each organ, when it has excess dampness or phlegm, it has its own symptoms. Clear? Okay?
Yes, sir.
Not okay?
Yes, sir.
So
Yes,
if,
sir.
if you read, pardon?
Yes, sir.
Where have that symptoms for individual organs?
Yeah. Each organ, when there is excess humidity, it will show up in a different way. Right? So you will have to read. Your second semester has to be strong. It is
Yes.
your so
Treatise 7.
treatise 7. Your treatise 7 has to be not strong, but it has to be super strong. Okay.
Okay, sir. Okay, sir.
So you have to read it 10 times minimum to
Okay,
be
sir.
that strong. Okay. So next is what? Interior movement of liver wind. Okay. Interior movement of liver wind. Okay, so it has a lot of concepts which you will have to understand. Okay, I will put it in a very simple way. So now imagine there is a container. And the water, the container has this much amount of water. Okay. And in the second situation, it has this much amount of water. Now, this is, I will say, fluid. And this is the amount of air. Right? When the fluid reduces, what will happen to the air? The quantity of air
Increase.
Increase.
And this
Increase.
air which is increasing, we call it as wind. When will the wind increase? When the fluid reduces. What is the fluid? Fluid is yin, that is water or blood. Blood is also a fluid. Yes, no?
Yes, sir.
Yes, yes.
Right. So when this, especially when it happens in the liver, because liver stores the blood, right? So when the storage of the blood reduces and the storage of the yin reduces, this wind increases. And this increase of wind is called as interior wind. There are two types of wind. external wind and internal wind. This
Internal
wind is called as internal wind.
wind.
Internal wind. Okay. What is external wind? The wind which comes from outside. You are going on a bike
Atmosphere.
without wearing helmet. So what is happening? The wind is hitting you. And you sit under a fan. The external wind is impacting. That is external wind. So the wind which is coming from outside. External wind. This is wind coming from atmosphere. That is external wind. But this wind is getting created inside the body because the fluid is reducing. Fluid is called yin or blood. Okay. So there are few types of liver wind. Okay. Liver wind. So somebody who has kept yourself mute. Okay. So liver wind is this wind. This happens mainly in liver. So, and why? Because liver is associated with which energy?
Wind.
Wind.
It is associated with wind energy. So liver wind. So it can happen when there is liver wind caused by liver blood deficiency. Okay. When the blood in the liver reduces, then it can create this wind. And second is caused by liver yin deficiency. Understanding? Okay. And the third one is caused by liver yang rising. Okay. See, suddenly somebody gets very angry. So the heat is increasing in the liver. And the nature of the liver is that it is also having wind. Now, somebody you may have seen a goldsmith, etc. What happens? So they have heat, and when they blow air to the heat, pass more oxygen to the heat, what happens to the fire? It becomes big. It becomes very hot. Yes, no?
Yes, sir.
Right? So similarly, when there is more heat and also this wind, so the yang rises in the liver. So it has more concept to it, which I will not go. So in these three situations, what will happen? The internal wind, liver wind, which is the internal wind will increase. Now, in the pipe, the blood is flowing. The blood is flowing. And you also make the wind more. And if the wind is becoming more, if the wind is also getting added, extra wind, right? This is blood. And this is wind. What happens to the pressure onto the surface?
Will increase.
The pressure will increase, creates high pressure. Okay. So this is one cause of high blood pressure. So if the blood pressure is because of any of these three winds, which is the internal wind, so you will have to put the appropriate protocol, which is given in the book. Clear?
Yes. Sir,
Yes.
there's one confusion. I'm having both books in my hands. They tie 7 in this, but protocol थोड़ा सा different है. तो मतलब I'm not मतलब
No. Don't worry about the protocols. So there are some standard protocol and there are some customized protocols. Okay. So sir has changed some points, customizing it. So, but the concept is more important. In points, there can be some plus or minus. Okay. So the last one is deficiency of yin or yang. Okay. So fifth one is deficiency of yin or yang. So what happens in this? When the yin becomes deficient, you understood. So when the yin becomes deficient, so normal fire, so normal amount of fire, but the water has reduced. Right. So that is creating boils fast. So this is yin deficiency because of less water. So this is called as yin deficiency. This part all of you have understood. Now, yin is also structure. Yin is also structure.
Yes.
The structure is getting compromised. What will happen to the function?
It will also get compromised. Yin deficiency will lead to yang deficiency because yang is not getting the fluid or energy to maintain itself. Diya and bati in the system.
When structure is compromised, when structure is
Function also compromised.
when structure is yin is compromised.
Function, yeah.
Function is impacted.
Then function will also get compromised.
Yes.
Function, that is yang, is also compromised. Okay. Now let's say when the function is compromised, say the pipe, when the arteries are there. I'm trying to give you a very simple. So this is your arteries. Now, when the function, the arteries are getting created by, it has to be constantly supplied, right? So the arteries structure is dependent on the function of something else. The structure of arteries is dependent on the function of spleen. Understanding?
Yes.
The structure of artery
is
dependent on
spleen,
on function, because this is created by earth element. So I'm only giving an example, small example, function of spleen. Now, if the spleen yang becomes deficient, what will happen to the structure?
Structure is shrink.
If the spleen yang becomes deficient, what happens?
The function is compromised, to structure of arteries will get compromised.
When spleen yang is deficient, then more food is converted into phlegm. Right?
Yes,
Dampness.
phlegm.
The
Yes.
dampness in the body increases. Yes, no?
Yes. Yes, sir.
Then
Yes.
then
It creates
Yes.
vicious cycle. Yeah.
then dampness in the body increases. Dampness is phlegm. Now, what will happen to all the phlegm which is getting created? So, it will go and slowly get collected on the internal part of the arteries. Yes, no? What
Yes.
will happen to the phlegm? It will get circulated or it will stay in one place?
No, circulate.
It will get circulated and it will get created in the arteries. Now, when this happens, what happens to the pressure of the body, pressure on the arteries, walls?
It will increase.
More increase. Increase.
It increases. The pressure
It's
Is increased.
increases. Now, what do I do in this situation? What am I first treating? I will first treat the spleen
Flame heat.
yang deficiency.
Hmm.
So that will remove the phlegm. And slowly the artery will become more
Normal.
normal. So the BP will reduce. So you're understanding the concept?
Yes, sir.
Sir, just tell frequent urination, how, especially at night, how is it related to this thing?
Pardon?
There's one symptom, frequent urination, especially at night.
Huh.
And these things only, there's one symptom, this.
Uh-huh. So
So should I consider it as a yin deficiency? So it's because of kidney yin deficiency?
see,
Kidney yang.
it is kidney yang deficiency.
yang deficiency.
Excess urination is what? Kidney
Yang deficiency.
yang deficiency. And reduced urination is kidney
Indeficiency.
बट सर नाइट में अगर यूरिनेशन प्रॉब्लम है तो वो किडनी yin में भी आता है.
See, you cannot categorize the protocol based on one symptom. You have to consider multiple
More
symptoms,
symptoms. Okay.
not just one. Okay. So if the body
वैसे
is
भी सर yang
no, if the body is feeling hot and there is excess urination in the night, then you can consider it to be indeficient.
Kidney yin.
Like empty heat is creating. If the body is cold and still there is excess urination in day and as well as night,
Then
then
yang.
you will consider kidney yang deficiency. So
Yang.
that's
Yes,
why I
yes.
told
Okay.
your treatise 7, that is semester 2, has to be super strong.
Okay, sir.
Okay. So
Yes.
this complete the high BP. Now imagine there are so many diseases related to heart and how much time it will require. Okay. It will require months together. Okay. So in the given time, so today I have covered the heart, a very small part of the heart, but with this logic or the way of interpreting the concepts, if you study, you will be able to understand and implement it better and you can become a better therapist. Okay.
सर
Okay,
जो
sir.
समझाया
लेकिन ये सर आपका जो केस स्टडी है वो तो
Very
अभी
good, sir.
थोड़ा बाकी रहा
one by
लंग्स का
one by one. Deva Vedanta Bhai, who wanted to speak?
Right, Purva.
Huh?
Sir, you taught us, na?
Huh?
It will remain for us in our brain forever.
Forever. Acha, fantastic. It has to be there.
So thanks a lot.
You're welcome. Anybody else? What somebody else was saying something?
सर
हाँ, दिनेश
अभी
जी.
जो आपका केस स्टडी था सर
हाँ.
वो अभी तो वो आप नेक्स्ट उसमें पूरा करा देंगे लंग्स का कैसे वो
हाँ, lungs का we will slightly decrease. No, we can see how we can cover it in lungs. अच्छा. And anybody else?
Means, sir, excuse me, sir.
Uh-huh.
Means sir, any CAD diseases, any dyslipidemia, first we should treat spleen yang, na sir, to decrease the flame.
Repeat the question.
Any diseases which is related with the cholesterol, dyslipidemia, or coronary artery diseases which are related to the flame, first we have to treat spleen yang.
Not necessarily. See, once again, there is a web of interlinking. So you may have to decrease the phlegm. See, when I treat spleen yang, it decreases the phlegm of the other parts of the body. But when the phlegm on the spleen itself has to be reduced, right? Imagine there is a barber. He does a very good haircut to everyone in the locality. But when the barber's hair has to be cut, what will he has to go to a different barber,
Yes.
right?
Yes,
So
sir.
similarly, if there is excess dampness on the spleen, then I will have to treat spleen damp attack, damp attack on spleen, or damp cold attack on spleen, damp heat attack or damp cold attack on spleen. So, and also we will have to remove spleen from liver, damp heat attack on liver and gallbladder, or it can be in lungs. So it doesn't have to be always spleen yang. So this is where the trickiness of the diagnosis comes. Okay. So many options are there. Clear?
Okay, sir.
So the answer is no, there is no simple one-line answer. So it is always customized to the patient. Which organ has excess dampness? Either it is in if it is in large intestine, say they will have sticky stools. So then we will have to remove it from large intestine. If it is in lungs, they will have excess phlegm, which is coming out through the cough.
Okay.
We'll have to treat in
Lung.
lungs. If it is in liver, they will have fatty liver, right? So we will have to treat the liver. And if it is in gallbladder, it will get created into stones. So we'll have to treat gallbladder. If it is in heart, so they will have excess speaking, or they will have in terms of thinking, it will be no fuzzy. So then we'll have to remove the phlegm in the heart. So many different options will be there. If it is in small intestine, they may have borborygmus or some other issues, difficulty in making decisions. So it varies from patients to patient.
But sir, the most foremost cause is the spleen, na? Because deficiency of spleen yang only causes the flame formation. It will not deposit anywhere. That is the another thing, na sir?
Okay. See, there are two ways of thinking. Okay, I'll quickly write it. Everybody's okay with I'll just take few more minutes.
Definitely, sir.
Okay, so I have, let's say, different organs. And this is spleen. So let's say this is heart, lungs, and let's say liver. Okay, there is excess dampness over here. Now, if this is the situation, okay, there is excess dampness in heart, which is more efficient? Removing the dampness through the spleen, or removing the dampness directly from heart, which is more efficient?
Directly from
Probably
heart.
from heart.
Yes.
But we need to treat. Don't we need to treat spleen also, so that the dampness again is created over there?
Listen. So to reduce the existing, treat, remove phlegm or phlegm from heart using heart protocol. remove existing phlegm. Existing phlegm from the heart using the heart protocol. And what do I do to the, why did it get created? Why did it create in the heart? Because spleen was deficient. So
After
treat
that,
spleen,
Very
treat
good.
spleen
treat root cause.
to
this is root.
strengthen to reduce the phlegm accumulation for the future. To treat spleen to reduce phlegm accumulation for reduce phlegm accumulation of future. Okay,
Cause.
making sense?
Yes, sir.
So whenever there
Yes,
is,
sir.
if there is phlegm accumulation in lungs, I will use lungs protocol to remove the phlegm, the existing phlegm, because it is much efficient, much faster. Okay, and if it is there in liver, I will use a liver protocol, damp heat in liver and gallbladder. So it becomes faster. And after that, if I don't treat spleen, what will happen? The phlegm will slowly get accumulated in the organ once again. Is this becoming clear?
Yes, sir.
Yes, sir.
Yes, sir. Thank you, sir.
Okay, great. Fine. Anybody else?
Thank you, sir.
Thank you, sir.
Okay. So I think everybody is okay with this. I hand it
Yes,
over
sir.
to you.
Is
Thank
there
you, sir.
any dampness in the gall? Hello, sir. Excuse me.
Yes, go ahead.
If there is any dampness in the GB, the stone is formed. Am I right?
Yes.
So how to reduce
So
the
there
size
is a
of the
protocol
stone?
called humid heat in liver and gallbladder.
Made it in
In
liver and
liver and
gallbladder.
gallbladder, so you have to apply that. So it is a very simplistic answer which I'm giving, but it has to be dealt in more depth. Okay.
It in liver and gallbladder.
So there is a protocol for that. So you can take a look.
Where can I get it, sir? In treatise 3?
Treatise 7.
Treatise 7.
285.
Okay. Thank you, sir.
Welcome. Okay,
Thank
with this, I hand it over to Ravindra, sir.
Yeah.
Thank you, sir.
Thank you, sir.
Thank you. Thank you.
One announcement tomorrow at 11:30.
Thank you, sir.
Electroacupressure, according to Dr. Wol, to be tutored by our Professor Sangeeta Barmanji, and the same Zoom link. At 6 o'clock, we have third semester BHB. For fourth semester, BHB is first and second, third semester revision. So I request all students to come and participate in these classes. And our Krishnamurti sir classes will be there at 7:45 on the same Zoom link tomorrow. It will be there till Thursday. So on behalf of everyone of you, I thank Krishnamurti sir for rendering a wonderful session. He has the capacity to convey the concept in the simplest possible manner. As someone has suggested, it will be remembered for throughout your life. It will be green in your memory. So attend all his classes and empower you. So with this, I bid goodbye for today. Tomorrow we'll catch up.
Thank you, sir.
Thank you, everyone. Thank you, sir.
Thank you, sir.
Thank you, sir. Good night, sir. Thank you, sir. Namaste, sir. Good night.
Thank you, sir.
Thank you.
Thank you, sir.
Thank you, sir.
Where can we get the recording of your sessions?
Ishan, search for Ishan Acupressure in YouTube. So these revision classes will be over there.